Hi, I'm Nancy Brown, CEO of the American Heart Association. This Heart Month, I'm thrilled to be joined by Representative Chris Smith of New Jersey, who serves as co-chair of the Congressional Heart Caucus. Thank you so much for joining today, Representative Smith.
Nancy, thank you so much for inviting. I appreciate it. And
Yeah.
thank you for your extraordinarily good work.
Well, thank you so much. And we are so grateful for the leadership of the Congressional Heart Caucus. And one of the things that I wanted to ask you about is tell us a little about why Heart Month is important to you.
Well, I've been in Congress now 41 years. I've known many members of Congress who have suffered heart or cardiovascular problems. Many in my family, including my grandfather, who died of a heart attack. My wife has members of her family who have died from heart attacks and strokes. So it's something that malaffects every one of us. And there's so much more we can be doing. Some of it is very simple in terms of lifestyle, making sure that we eat right, exercise, get good nutrition, the right kind of vitamins and the like. This is preventable to a large extent. Yes, some heart problems will manifest, some are hereditary, but much of it is preventable. And that not only from the standpoint of losing your life, but also disability that follows after a stroke or some of these other terrible manifestations of heart disease. So it's a winnable war, and we need to be willing to give it everything we have. There's a lot of money, as you know, that NIH and we continually up that pot of money for the NIH, the CDC, and a number of very specific programs, especially targeted to women who are disproportionately malaffected again by heart disease.
Yeah, such an important point. And I know that along with Representative Joyce Beatty, you're co-chair of the Congressional Heart Caucus. You and the caucus have a laser focus on addressing these issues, and we're so grateful to you for that, especially during a global pandemic. We know that cardiovascular disease remains the leading cause of death in the United States, and experts predict the burden will grow as we see the long-term effects of COVID-19, which we know can damage a patient's heart, brain, vascular system, and other vital organs. Tell us a little about how Congress is supporting research on the coronavirus and how it attacks the body and the life-threatening complications.
Well, in the last appropriations bill, the fiscal year 2021, we had specific language that focuses on the impacts that intermediate long-term effects of COVID-19 has on the heart and other vital organs. Because we know it's there. There's more than just anecdotal suggestions of it. And since the virus is only, a little over a year old, we're still learning. But that's where we need the scholarship of the NIH deploying its critical funding to make sure that people who now are hurt because of that, because they had COVID-19, for example, but now they also have concurrent problems that are heart related.
The other thing about the global pandemic is that many Americans, as they have been sheltering in place or staying at home, have developed unhealthy eating habits and sedentary lifestyle, and actually, maybe even have some issues of anxiety or mental health concerns. And of course, at the American Heart Association, we worry about all of these things because they can increase the risk of heart disease and stroke. How can Congress help prevent cardiovascular disease by emphasizing proper nutrition, physical activity, and other healthy behaviors?
It's a great question, Nancy. One is to accelerate our visibility, to focus on making sure you get that exercise 30 minutes a day or whatever it is that works for you. I'm encouraged, though, I see in my neighborhood, a lot of people are walking. They're out there, husband and wives, children, they're all out there walking. And the more we encourage that, the better. And that doesn't take legislation. That just takes a lot of common sense and a big push. And you guys have done a great job of emphasizing that. So exercise is critical. Again, as we do the funding, because we're the funders of these important projects, to make sure that NIH keeps its eye on that ball. A lot of people have not gone into the hospital who need, or even to see their doctor, who might need some preventive work or to catch early the manifestation of heart disease. And so there's a backlog there. In the early days, COVID was exclusive at our hospitals, and all of those types of interventions became forgotten, not really forgotten, but just not scheduled. So there needs to be, I think, a re-emphasis on, those visits to make sure that the blood pressure and everything else is being properly monitored. Because all of again, cardiovascular disease is largely preventable, but it does take a plan, and everyone has to have their own plan, especially as they grow older.
Yeah, so such important points. And as a matter of fact, the lack of access of emergency medical care during the beginning of the pandemic is exactly why at the American Heart Association, we created a campaign called Don't Die of Doubt to remind people of the urgent need to access emergency care if they were having the warning signs of a heart attack or of a stroke, and how important it is always to listen to our own bodies. We're so grateful to you, Congressman Smith, and to Representative Beatty for leading the Congressional Heart Caucus, for keeping these issues at the top of minds of our elected officials. Thank you for your leadership. Happy Heart Month.
Thank you.
And we'll check in with you again real soon.